what is Masterclass in Practical Geriatrics and why you should consider joining our growing community. Hello, I'm Dr Elena Mucci, Fellow of Royal College of Physicians of London, member of American College of Physicians, and I have been a consultant geriatrician and stroke consultant over the last 10 years. I have 20 years of clinical experience and I work in southeast of England. In a few years' time, every fourth person in United Kingdom will be over the age of 65. And as healthcare professional, not only you are very likely to be involved in the care of older adults, but you also will be expected to look after them and provide for their complex medical needs within the multidisciplinary team. Hence, this masterclass, the first unique course which is designed for all members of multidisciplinary team, because I'm aiming to bring us together, understand the basics of frailty, multimorbidity, polypharmacy, and be able to do that comprehensive geriatric assessment for your patients. I will take you from zero to become heroes of your patients. All of you have a lot of knowledge. Some of you are already quite experienced clinicians. My job is to channel your skills and knowledge in the direction of understanding frailty and multimorbidity so you can see the patient holistically and be able to do future care plans, preventative medicine, be able to communicate the very difficult issues with the patient and with the family. Who is it for? As I said, it is for all members of multidisciplinary team, regardless whatever specialty you are working. As long as you spend a lot of time in your working life with older adults, this course is for you. Some modules within the masterclass might seem a bit challenging for you. However, my aim is to push your boundaries, realize your potential, and help you to become the best professional you can be. You just need that push. You need the mentor, and I can be your mentor, and you need the foundation upon which you can build and grow, and the masterclass can be that foundation. Masterclass consists of 10 modules and it is fully CPD certified course with 30 CPD points. Although I do advise to complete the modules sequentially, you might need to jump from one module to another, miss a few modules here and there, and you might eventually within the next 12 months, and that's how long you have with the masterclass, finish every module. Module 1 is on frailty. By the end of this module, you will have a clear idea why your patients decondition so quickly. You will be able to explain the concept of frailty to the patients as well and be able to put together a future care plans and hospital admission avoidance plans. Module 2 is foundation of the masterclass. I do recommend that all healthcare professionals complete these 2 modules. I appreciate that you will be picking and choosing different modules depending on the area of your expertise and the specialty you are working in, but module 1 and module 2 should be done. You will be able to discuss and put together a plan which will prevent future delirium episodes in your patients. Module 3 is my favorite. It's prescribing and polypharmacy module, and it is packed with useful information, but I'm going to give you some very important tools which you can use next day to help you to do prescribing and polypharmacy reviews for your patients who come to hospital with enormous medication lists. Interestingly, you will find a lot of polypharmacy even in the short medication list, so keep an open mind. Module 4 is a bone health module, and it is absolute must for frailty practitioners, for falls practitioners, district nurses, and of course junior doctors, physician associates who work within the frailty teams or in acute assessment units, because you guys will see patients coming with falls every single day. So by the end of this module, you will be able to do a structured bedside falls assessment, put together falls prevention plan, and be able to appreciate the multifactorial nature of falls, because guess what? There is no such a thing as mechanical fall. Module 5 is on end-of-life care, and it is a subject I'm very, very passionate about. Now, Module 5 is not a palliative care module, and although I have included lecture on symptom control, the main emphasis of this module is on end-of-life care communication and prognostication. So again, it is packed with a lot of tools which will help you to prognosticate the end-of-life care in your patients and be able to best advise the patient and the family on how to proceed in the whatever length of time they have left and how to get the best out of their life. Module 6 is a cardiovascular geriatrics, and it is the largest module of the Masterclass. It has 5.5 CPD points. In fact, it can be a course on its own. It is absolutely packed with tips and clinical pearls you can use in your everyday practice. The idea of the cardiovascular module was to help you to look after your cardiac, all the frailer patients, use the evidence-based medicine, improve their cardiac outcomes, but also be safe, because how many times do we see patients being readmitted to hospital as a result of the side effects of cardiac medications? There are many ways to improve the safety of our frailer cardiac patients, and that's what this module is about. Module 7 is PreOperative Assessment. All of us will be looking after patients before, during, and after they are going for surgery, and it is a multidisciplinary team management as well. We do not have enough geriatricians to do the perioperative assessments, so with this module, I am trying to show to you how important your role is, whether you are a physiotherapist or a district nurse or a general practitioner, in preparing your patient for surgery. A lot of our older patients have anemia, especially the surgical patients, so the emphasis of this module is on anemia, but also I do talk about comprehensive geriatric assessment for our surgical patients. Module 8 is old age psychiatry. At least 50% of my patients also have comorbid mental health issues. A lot of my patients do like having it all under one roof, so I learned old age psychiatry, which I practice very actively, and I will share a lot of clinical pearls with you so you can work together with your community mental health teams, hospital mental health teams, and be able to treat your patients yourself in some instances. Module 9 should be a really fun module because I have a collection of interesting cases I've accumulated over the last 20 years, and what I'm going to do is I will put a case, I will ask you to guess the diagnosis, and then I will reveal the diagnosis and share a little bit of learning around the case. It will be very enjoyable, I promise. Module 10 is our final summary module. It is comprehensive geriatric assessment, and really we will be bringing all the knowledge together, all the learnings together. We will go through a few real-life cases where myself and my frailty practitioners did comprehensive geriatric assessment. We will share their outcomes, but also I will talk a little about service development as well. Thank you. I hope I've been able to show you how important this masterclass is for our patients, but also for you. It is transformational. It does transform the lives of our patients when we provide personalized, bespoke care along with evidence-based medicine. But it is also going to be transformational for your career. I promise you will see big career jumps after completing this masterclass and practicing the learnings in your clinical practice.